So you think you have frozen shoulder, but how can you be sure? Because with so many shoulder problems having pain, it can be a bit tricky to pinpoint what exactly is going on. So to add some clarity to a perplexing condition, let's break down some key signs and symptoms of frozen shoulder to help you determine if this might be the issue you're dealing with. Frozen shoulder often begins insidiously, meaning without any warning or reason. You might wake up one day with a nagging pain in your shoulder, or maybe you begin to notice it after something as simple as reaching back into the backseat of a car or brushing your hair. But what starts as mild discomfort can quickly escalate and turn into something that disrupts your sleep and daily activities over the next couple weeks. This isn't just any old pain either. It's often sharp or achy and tends to get worse with certain shoulder movements. You might even notice that simple actions, like reaching up to a high shelf or trying to tuck in your shirt, is becoming increasingly difficult due to pain. At this stage, many people are often misdiagnosed with subacromial impingement, another shoulder issue that shares similarities with the early stages of frozen shoulder. But what makes frozen shoulder really stand out, apart from other shoulder conditions, is its resistance to typical treatments that usually offer relief. The pain and stiffness persist despite resting, medication, and rehab exercises. And as the condition progresses, the shoulder becomes increasingly stiff, and movement becomes more and more challenging. This growing stiffness and the persistent nature of the symptoms are a strong indicator that you might be dealing with frozen shoulder. An orthopedic physical therapist or doctor will look for a few specific indicators to diagnose frozen shoulder. One major sign is a noticeable loss of shoulder motion. If you've got more than 25% reduction in shoulder movement in at least 2 different directions, and more than a 50% loss in external rotation compared to your other arm, you may be dealing with frozen shoulder. Another common sign is called the shrug sign, where you might find yourself shrugging your shoulder while trying to lift your arm overhead because of the shoulder stiffness. X-rays are typically used to rule out other conditions like arthritis that could be causing your shoulder pain and stiffness. They won't reveal, however, the soft tissue changes associated with frozen shoulder, such as capsule tightening. An MRI, on the other hand, is more detailed and can show thickening of the joint capsule and other soft tissue changes that come with frozen shoulder. However, imaging is often not needed because the diagnosis is clear enough based on a medical history and a comprehensive physical exam. Want to know how long frozen shoulder will last? Well, take a look at this next video where we dive into the expected timeline of frozen shoulder. And if you found value from this video, don't forget to give it a like and hit that subscribe button so you can learn more about your body, how it works, and what it needs to keep moving.